Welcome to the Saul's Newsstand News Review for March 8, 2019. The Washington Free Beacon is reporting over 100 House Dems support banning private health insurance plans. A radical new health care proposal that, if implemented, would ban private insurance coverage has garnered the endorsement of more than 100 members of the House Democratic Conference, nearly half of Speaker Nancy Pelosi's 235-seat majority. Last week, Democratic Congresswoman Pramila J. Paul, the co-chair of the Congressional Progressive Caucus, introduced the Medicare for All Act of 2019. Billed as a means to provide freedom of choice to healthcare consumers, the legislation would require everyone, regardless of existing insurance coverage, to enroll in Medicare within 2 years of passage. Under the proposal, all primary hospital and outpatient services would be covered by Medicare without any copay or out-of-pocket expenses. The proposal's most controversial aspect, however, entails the phasing out of private insurance plans. The bill would make it illegal for private insurance providers to sell health coverage that duplicates the benefits offered by the taxpayer-funded Medicare for All program. Likewise, the bill prohibits employers from offering coverage to their employees if it mirrors those offered by the federal government. Private health insurance plans could only be sold to individuals or offered by employers if they provide supplemental coverage on top of Medicare for All. Other provisions in the bill limit the federal government from subsidizing any private insurance plans. An article from The Hill states, top White House officials warn hospitals on surprise medical bills. A top White House policy advisor on Monday warned hospitals that they need to address the issue of surprise medical bills if they don't want Congress to do it for them. If hospitals, providers, and insurers don't protect these patients from financial harm, Congress and the administration will need to act, said Joe Grogan, director of the White House Domestic Policy Council. Calls for action against so-called surprise medical bills have been growing, and legislation to protect patients from surprise medical bills is seen as one of the most likely areas for bipartisan action on health care this year. A surprise bill usually occurs when a patient receives a sizable bill after going to a hospital, often because they receive treatment from a doctor outside the patient's insurance network. Grogan said the administration has not yet coalesced around a particular solution to the problem, but warned that any likely legislation or administrative action will be worse than if hospitals solve the issue themselves. Grogan stated, "You have to come up with a solution or bad things could happen, because you'll have policymaking being made by people that don't understand the system nearly as well as you." And finally, another article from The Hill is reporting, drug company announces new version of insulin at half the price. The drug company Eli Lilly on Monday announced that it is introducing a cheaper version of its insulin that will sell at half the price, a decision aimed at tamping down on the outcry over insulin prices. The move comes in response to intense scrutiny of drug prices, and particularly insulin, a decades-old drug that people with diabetes need that has seen huge price spikes in recent years. The move received some measured praise from lawmakers in both parties on Monday, but they also stressed that much more needs to be done. Insulin has become something of a poster child for the wider problem of high drug prices, given that it is not a new invention and is needed for many people to survive, yet has had major price increases. Insulin is perhaps the highest profile example of a growing storm over drug prices. Both President Trump and congressional Democrats have railed against high drug prices and called for action, making the issue a rare area where there is at least some chance of bipartisan cooperation. That landscape has left drug companies on high alert and trying to prevent any major action that they view as damaging. And that concludes your Saul's Newsstand News Review for March 8, 2019. For more political news faster, visit saulsnews.com.